Hello, my fellow classmates and professor. Today we are going to talk about disseminated intravascular coagulation. Now let's turn to point 1. Definition. Disseminated intravascular coagulation or DIC is a syndrome in which either the extrinsic or intrinsic or both pathways are activated to produce multiple fibrin clots in small blood vessels. The resultant reduction of the coagulation factors and platelets result in bleeding. Point 2. Pathophysiology. Increased tissue factor activity and thrombin generation. Tissue factor is expressed on circulating activated monocytes in sepsis-relating DIC and on the surface of the malignant cell or circulating tumor-derived microparticles in cancer-related DIC. And obstetric DIC, placental abruption and amniotic fluid embolism expose the circulating blood to tissue factor. The activation of coagulation factor 7, increased tissue factor activity leads to thrombin generation.
Increased platelet activation in the DIC occurs through interaction with activated endothelium and the direct actions of thrombin on platelets. In sepsis, release DIC information cell, cytokine, and pathogen interact directly with platelets and contribute to their activation. Level of interthrombin, protein C and protein S decrease due to consumption, decreased synthesis in the liver, and degradation by neutrophil elastase. Fibrinolysis can be either impaired hyperfibrinolysis or enhanced hyperfibrinolysis according to the pathophysiology of the underlying disease. Both tissue plasminogen activator TPA and plasminogen activator inhibitor 1 PAI1 are released of the activated endothelium. In sepsis, the net effect is impaired fibrinolysis. In most cases, in contrast, cancer is often associated with increased fibrinolytic activity. Primary hyperfibrinolysis is a common feature of acute promyelolytic leukemia. These patients often present with severe hyperfibrinolysis and bleeding due to increased plasminogen activation on the malignant cell surface.
Etiology. When you are injury protein in the blood that from the blood clot travel to the injury site to help to stop bleeding. If this protein become abnormally active throughout the body, you could develop DIC. The underlying cause is usually due to inflammation, infection, or cancer. Secondary fibrinolysis following the CT. Fibrinolysis get activated and PDPS dimer format has an inhibitory effect on clot formation. Plasmid format inactivate 7 and 10 which future inhibit intrinsic coagulation cascades.
Signs and symptoms of DIC may include bruising, which may appear easily and often in various areas as small dots or larger patches, bleeding at the site of wall from surgical cuts or from placement of a needle, bleeding from the nose, gum, or mouth, including when you brush your teeth, blood in the stool from bleeding in the intestine or stomach. Stool may appear dark red or light tar, blood in the urine, chest pain, trouble breathing, and shortness of breath, confusion, speech change, or trouble speaking, dizziness, serious headache, low blood pressure, pain, redness, warm, and swelling in the lower leg, unusually heavy periods, petechiae, and purpura. Thank you for attention.